All right. Thank you, Clint. And welcome, everyone. Miranda, do you need to take roll call, or how would you like to do that? Just from what you see?
Yes, and I see that Ellison is not here. I'm questioning if we have a quorum.
Yeah.
Sherry Adams?
Here.
Daryl Birch?
Daryl is not coming, yes.
Daniel Churchill, he declined. Kevin Dufany? He did accept, so he might be popping on. There's Allison. Mary Gumke? She sent me an email saying that her flight got changed, so she will join as soon as she's able. Missy Hankey? Carrie Ann Randall?
Yep.
Kristen Roars? And Mark Strand?
Here.
So we have 3 here, 6 absent.
I think Missy just joined.
I just joined, yep.
Okay. 4 and 5.
So we don't have a quorum.
Is our quorum 50%? So
Yes, it's the majority. So since there are 9 members, it would be 5.
yeah.
Okay. So we can wait a couple more minutes to see if a 5th one joins. Otherwise, we'll have to probably, because everything needs to be voted on today. Miranda, was there anybody else that accepted that isn't on yet?
Kevin did.
Okay.
And Mary said she'll be late, but she didn't say how late.
Okay. Well, while we're waiting, since we can't vote on anything, are there additional agenda items that we would like to put on the agenda, if it's today or next week? Or next, whenever. And I know Mark had one to add on to discuss possibly legislatively bringing forth, adding local public health, like master's public health workers and environmental health workers to loan repayment program, to see if we can develop more workforce at the public health level.
Thank you.
So, yes. So we'll put that on the agenda today. If we don't have a meeting, we'll put it on the agenda for next. It'll probably be on the agenda for a couple, because legislatively it has to go through legislation. Well, those that are on live stream, this is pretty exciting.
I'm looking if I have a phone number for Kevin. I can give him a call.
Okay, that sounds good. And while you're waiting, if you haven't read the minutes, and nice job, Mark and Miranda, go ahead and read those so that we can have somebody approve them if you haven't read them yet. Oh, good point. Mm-hmm. There's a lot of people on.
I'm not
We have-
finding a number for
Okay.
Kevin. Does anyone have one?
Well, we'll give it to a quarter till. And then we'll have to talk about rescheduling if we don't have a quorum.
Jerry,
Yes.
this is Kelly. If you don't have a quorum, just a heads up that Kaylee might have issues because she needs to have approved awardees for the loan payment program to issue contracts.
Okay. I know Daryl's on an airplane, so we can't call him. Has this ever happened to these meetings before? Well, I guess we could do the agenda backwards and Dr. Wiebe could give his update because I don't think we have to vote on that. That would give us a little bit of extra time.
We cannot call the meeting to order until
Oh,
you
okay.
have a quorum.
Thank you, Allison. Okay. Any other suggestions? Not sure how to help Kaylee if we don't have a quorum.
Honestly, we also have administrative rules problems because those also need to be voted on to move forward. So I guess my suggestion, if we can't get a quorum today, we just need to reschedule as soon as possible. Kaylee,
Okay.
when do you need to enter into your contracts by June 1st?
July 1.
So we have a little bit of time to reschedule. The more time sensitive stuff is actually the administrative rules, like that has time frames. So why don't we start? I mean, you've got 5 minutes. I hate to waste any more of anybody's time. Why don't you start talking about meeting times the next couple of weeks?
Okay, thanks, Allison. I know I am going to be out of the country for most of June, but let's look.
What about next Tuesday, same time, same place?
Next Tuesday.
Dr. Wiebe is out of office.
Okay. Thursday, June 1st.
He actually has quite a bit of travel coming up.
Madam Chair, Jason Wall here. I just need to make sure the Health Council is aware that if we don't get the rules approved today, we are not going to be able to meet the administrative rule timelines and deadlines. And so instead of the proposed rules becoming effective October 1, we would be looking at January 1 as being the earliest we would be able to meet the advertising timelines and the legislative council and the Attorney General's office.
Oh boy. I don't have phone numbers to call anybody, but I suppose they can't, they still have to be present.
So did all 5 of those individuals dismiss themselves prior to the meeting or request leave?
No. Kevin accepted. Kristen was tentative, and so was Daryl.
Well, I know for sure Daryl's not, because he said he was going to be on the airplane.
And Mary will be joining. I just don't know when. I will get in touch with the governor's office right now, the person who's in charge of boards, and see if I can get Kevin's phone number.
Thank you.
This is Clint in the control room. Normally I am not audible on the live stream, but I would just like to reiterate, if we do have any members who clicked on the live stream link and are watching this on YouTube, you're not in the meeting, make sure that you use the meeting link to join. That has happened in the past. It's an easy mistake to make, but just to make sure, if we have any members who are watching the live stream, we need you to go back and click on the meeting link from the email.
Not even the governor's office has a phone number. I did send him an email about 5 minutes ago and haven't heard anything.
Well, you have certainly been doing your due diligence and trying. Anybody have Christy Rohr's phone number? Or Kirsten Rohr? Could call her.
I do have that one. I'll give her a try.
Let's try.
Miranda, this is Jason. I just tried her cell number. and got no answer.
Well, it was good effort on your part.
I do have a second number. Tried both, no luck.
Okay. What does the rest of you guys' day look like? That maybe we could disconnect and try to get a hold. Of course, we've been trying everybody, so I don't know if that'll be work. I know I can't do it tomorrow.
Since we're scheduled until, what, 10:30, could we kind of play it by ear, and can I get phone numbers for everyone and log back on if I can get in touch with either Carrie or Kevin or Mary?
That would be, is that okay, Alyssa? Allison, I mean.
Yep, that would be fine. Is there a chat function? Or can everybody just individually email Miranda your phone numbers? I don't really want you on a public meeting to tell everybody like your personal cell phones and stuff. So can you just email Miranda a good contact number for you for the next hour and a half? Nope. We're not going to have discussions of governing bodies in private session. So you can all just email Miranda your phone number. It would be very helpful if we could do that, but I do not want there to be any perception of any open meetings violations. So if you could just make sure that Miranda has your contact information for the next hour and a half, I think she can contact everybody. And then for tech, because this is an open meeting and because I don't want us to terminate the meeting and then the public is excluded, is there any way to leave this open and say that the Health Council will be convening shortly or by 10:30 or something like that? Nope, just until 10:30 when the meeting is noticed. Because the concern that I have is if we end this meeting now, technically if we reconvene, it will be a special meeting.
Gotcha. I will come
So
up
I
with
make a motion that we take,
what kind of language would you like to use for
Can't
an
do any
output?
motions. So Mark, if you have a suggestion, just go ahead and say it, but we cannot do any type of motion. There is no meeting.
okay, forget it. I do have a question, a tech question. Is the information in the chat seen by the live stream participants? Thank you.
So I think, Clint, if you could just put, like you normally do, put the logo up and just say,
That's it. There you go.
meeting will convene, hopefully convene by 10:30. Or something like that. There you go. That's that one. The Dakota Legendary. Okay, then we'll just hang up for now and get your information to Miranda. And if you know anybody on the board that's not here, please call them and beg them to come on so we can try to get some of this resolved. Miranda, how will you reach out to us?
Cell
So
phone.
Okay, so that we know. Okay, perfect. That sounds good. All right, I'll sit by my cell phone and wait.
Question, does that mean if we don't get a call on our phone, this is not going to happen, so we can just, or do we want to check back in here at any point in time as a final check-in?
I can send an email at the end.
Yeah, Miranda will send an email either way. So if we do not get a quorum, then she'll just send an email saying that the health council meeting will be rescheduled.
Okay, thank you.
Thank you.
All right. Well, we'll keep our fingers crossed. Thanks, everybody.
Thank you.
Want to call the meeting to order first?
Yes, we'll officially call the meeting to order. For those of you that might be live, sorry for the delay. I will have Miranda call roll now.
Sherry Adams,
Here.
Gerald Birch, Daniel Churchill, Kevin Dufany, Mary Gumpke,
Here.
Missy Hankey,
Here.
Carrie Ann Ranum,
Here.
Kristen Roars, Mark Strand.
Here.
Okay, we officially have a quorum.
This is Clint in the control room. One last thing. I know that I said we have a COVID briefing out of this studio at 11. Please take the time you need. I'm working on a plan B for that. I want to make sure that you're able to get your business done, and I will roll with that next thing.
Okay, thanks, Clint. And thanks, Miranda, for doing all that in this last few minutes. The minutes were sent out. If somebody wants to make a motion to approve them,
Mark Strand, move to approve the minutes of the May 24th meeting. I'm sorry, of the previous meeting.
thank you, Mark. Is there a second?
Second.
Anybody, all in favor, say aye.
Aye.
Thank you. We're going to go next to Kaylee. She has quite a list of loan applicants letters that Miranda sent out.
Madam Chair and Council. So yep, you should have received a large list of those that have applied. Our cycle officially closed. The 2022 cycle closed March 15th, and I do have some numbers for you. We had a total of 103 applications. Not all of those were complete, some were duplicates, but when we kind of get into the nitty gritty, we had 6 physicians apply. We had 19 advanced practice, 4 dentists, and 74 behavioral health. So we'll kind of just dive right into it. The first one that you'll see are the recommendations. Those will be, we'll start with the physicians. So those are the 3 physicians that the committee, the physician committee recommended. Do you guys have any questions on them? It would have been Dr. Emily Stromquist, Dr. Shelby Dvorak, and Dr. Samantha Kudrowski.
I just have a question on, just refresh our minds because
Yeah.
I'm new and I know there's others. How many, are these the new ones? And then how many do we approve or not approve? Or if you could
Yep, so
refresh my mind.
Sure. Yep. These are the new applications. So these are the new applicants. We have 3 slots available this year for physicians. So we had 6 apply. We have 3 slots, and those were the recommendations put forth by the physician committee.
Okay, thank you. So I'm assuming the next thing is to vote to have a motion to approve those 3.
Correct.
Is there a motion to approve those 3?
I make a motion to approve those 3.
Thank you, Carrie. Is there a second? Or wait, any discussion?
Well, we need a second first. I'll second it.
Okay, thank you. I'm about 3 steps behind today. Any discussion? Any discussion? Any discussion? All right, all in favor of approving those 5, please signify by saying, first I should ask Miranda, do we have to do a roll call vote?
I believe so. Is that correct, Allison?
That's correct.
Okay, thank you. So I'll let you do the roll call.
Sherry Adams,
Yes.
Mary Gumpke,
Yes.
Missy Hankey,
Yes.
Carrie Ann Ranum,
Yes.
Mark Strand.
Yes.
5 yeas, 0 nays.
Thank you. Kaylee, we'll go to the next group. And then if you could do the same thing, like say how many slots and et cetera, like you did before,
Yeah.
that's very helpful.
Absolutely. So the next group we have is the dentists. We had 4 applications, 3 complete applications. We have 3 available slots. So we had a Dr. Luke Weston, a Dr. Paige Fishjohn, and a Dr. Maria Meyer.
Thank you. Is there a motion from the group to accept those 3 applicants?
I motion to accept those 3.
So moved.
Thank you. And then Missy, do you want to do a second?
Yes, I'll second it.
Thank you.
Yeah.
Any discussion on those? Any discussion? Discussion. Okay, Miranda, another roll call vote?
Sherry Adams,
Yes.
Mary Gumke,
Yes.
Missy Hankey,
Yeah.
Yes.
Carrie Ann Ranum,
Yes.
and Mark Strand.
Yes.
5 and 0.
Thank you. And go to the next one.
Okay. The next one will be the advanced practice providers. We have 3 available slots for advanced practice providers. We had 12 complete applications. Recommended by the committee is a Hannah Bailey. She's working in Bismarck at the behavioral health in Sanford. Kelly Glick, she's a physician assistant. She's at CHI St. Alexius Health in Dickinson. And a Brittany Bollinger, she is at Connect Us Therapy in Williston.
Thank you. Is there a motion to accept these 3 applicants?
I motion to accept those 3 applicants.
Thank you. Is there a second?
I second it.
Thank you. Any discussion? Any discussion? Any discussion?
Yeah, I'm wondering, Bismarck and looking at the guidelines, for site eligibility, it's healthcare workforce shortage. And one of the issues is, cities of less than 40,000 persons. I'd like clarification on what role that plays in a decision like for these individuals. All 3 of them would be cities of more than, at least Bismarck and probably Williston. Can you help me with that, Kaylee?
Yeah, I think that's a great question, Dr. Strand. And I think with what's written in Century Code, and Allison, you can kind of verify, but it is priority is given to those individuals. However, in our group discussion this year, the 3 that were selected were based off of the one was serving a behavioral health population. So they felt that that was a high priority. And so, they kind of prioritized, of course, Kelly Glick out of Dickinson. It's kind of questionable, but, they consider Dickinson rural, same with Williston. So that was kind of their discussion around why they selected those 3 individuals. And then, of course, there's a lot that goes into they're reading the letters of recommendation, they're reading their personal statements. And so just to, getting a feel of their investment in North Dakota, their investment in their community, and of course, the population they're serving. So all of that goes in there. But as of now, Century Code says priority, but it's not has to be in a rural setting. Hopefully that helps. Allison, if there's something I'm missing or that you need to clarify.
It also looks like for those advanced practitioners, all of the applicants that you have on that other document is that the majority of them are from Fargo or Grand Forks or Bismarck. There is one from Jamestown.
Mm-hmm. Yep, we received quite a few number of individuals that were working in more of our urban areas this year.
To kind of piggyback off of what Kaylee had said, it does say high priority to areas with a critical need. It doesn't say what the areas are, whether they're specifically geographic or if they're also considering practice areas. So like Kaylee had indicated, if somebody is working in behavioral health, well, there's a shortage all across the state, even in the urban areas. Or if somebody's doing like something involving substance abuse or something like that, there are areas of critical need in practice areas that it's the entire swath of the state. It's not just specifically geographic shortages for practitioners of any type. And we have talked, if that is something that the Health Council wants to specify, it's not specified in state law, but if the Health Council wants to direct those loan programs to go to, for example, rural geographic areas or areas with a specific HIPSA score or something like that, then we should talk about tasking the loan repayment programs with drafting administrative rules to specify that, to give the committees and the applicants guidance as to what is being expected. So if the Health Council wants to see more rural practice areas, low HIPSA scores, that type of thing, then that would be something that you need to direct Kaylee to start working on drafting. It's not clear in Century Code, and when it's not clear in Century Code and you haven't provided any clarification, it's up to the committee's discretion, and this is the discretion they have exercised.
Thank you. That is good clarification. And it may be something we look at in the future, for discussion.
And just to add one last comment, that's all very helpful. Thank you. One last comment would be whether these individuals are providing telehealth services, because that's also specified in the, priority individuals. And so I don't know if that's something, I'm assuming the committees are looking at that as well. And so, someone might be located in Bismarck, behavioral health services in Bismarck, but if they're providing telehealth to rural communities, well, that's fantastic. I know individuals taking telehealth support from Utah right now because they have such a robust behavioral health support system. So just add that telehealth feature as well into consideration. Thank you.
Any other discussion? Okay, Miranda, do you want to do another roll call vote?
Sherry Adams,
Yes.
Mary Gumke,
Yes.
Missy Hankey,
Yes.
Carrie Ann Ranum,
Yes.
and Mark Strand.
Yes.
And I
5 yeas,
apologize
0.
that, okay, sorry, Miranda, I apologize. I don't have my list in front of me. Is there any other categories?
Yes, we have 2 more to go through.
Okay, thank you. I'll let
You're
you
welcome.
continue.
The next group is our psychologists. We are able to fund 2. We had 4 applicants. Recommended by the committee is Dr. Alyssa Weber. She is at the North Central Human Service Center in Minot. And the second is a Dr. Alyssa Parson. She's in Indigenized Behavioral Healing out of Belcourt.
Great. Is there a motion to accept those 2 individuals?
Mark Strand, move to approve.
Thank you, Mark. Is there a second?
Second.
Thank you. Any discussion on these? Any discussion? Any discussion? Okay, we'll do another roll call vote.
Sherry Adams,
Yes.
Mary Gumke,
Yes.
Missy Hankey,
Yes.
Carrie Ann Ranum,
Yes.
Mark Strand.
Yes.
5 yeas, 0 nays.
Thank you. And the last group.
The last group is our behavioral health group. This is kind of a large group of folks, but as you can see, we allow for licensed social workers. So that would be an LCSW, LBSW, and a LMSW. So master's, bachelor, and then the clinical. The licensed professional counselors, the licensed addiction counselors, behavioral analysts, and your behavioral registered nurses working in behavioral health. So it's quite a large group. We had 6 slots to fund. With the extra funding from defaults this past year, we were able to fund 13. And so you have a few extra recommendations on your deck that I sent out. I'll kind of go down my list. Recommended by the committee was Katie Shannon. She's a LCSW working at Connect Us Therapy in Williston. Second is Jenny Cornell. She's a licensed clinical social worker working at Summit Counseling Service in Williston. Third is Peggy Burkhardt. She's a LBSW working at Nexus Path out of Devil's Lake. Fourth is Lisa Reese. She's at Lake Region Special Education out of Devil's Lake. Fifth is Naomi Cook. She is at CHI St. Alexius Clinic in Valley City. Sixth is Dawn Slag. She's an LMSW at Good Road Recovery in Bismarck. Seventh is Justin Colden. He's a licensed addiction counselor at South Central Human Service Center in Jamestown. I think I'm on 8. Holly Johnson. She's a behavioral analyst at Life Skills Transition Center in Grafton. Next is Christy Keeland. She's an LBSW at Stand in Fargo. Next is Nicole Myers. She's at the Kids Therapy Center in Bismarck. Next is Morgan Turner. She's at Heartview Foundation in Bismarck. The next one is Jessica Bowden. She's at the South Central Human Service Center in Jamestown. And the last one is Andrea Cornelius. She's at the Total Behavior Support in Minot. So those are the 13 that the committee is recommending for loan repayment.
Thank you. Is there a motion to accept these 13?
I make a motion to accept.
Thank you. Is there a second?
Mark Strand, second.
Thank you. Any discussion? I do have a question. Is that will these 13 be able to be sustained for their time frame?
We hope so, but I think that's certainly some discussion we can have in the next section when we talk about our site transfer requests and our defaults.
Okay. Any other discussion?
Adams, can I ask a follow-up question? Did you mean those 13 have their funding sustained, or we have 13 slots sustained?
13 slots sustained.
Okay, thank you.
Yep. I mean, I think that's great. And then in a future meeting, we're going to try to add some discussion on loan repayment, possibly for public health workers. So we'll try to have that as part of the discussion as well. Any other discussion on these? Okay. Miranda, I think that was 3 times. Miranda, would you do a roll call vote?
Sherry Adams,
Yes.
Mary Gumpke,
Yes.
Missy Hankey,
Yes.
Carrie Ann Ranum,
Yes.
Mark Strand.
Yes.
5 yeas, 0 nays.
Okay, thank you. Kaylee, did you have more to discuss?
I did, yeah, and we, and then you should have received an Excel document with the site transfer requests and the defaults at the bottom. We have quite a large number of both this year, and so when you asked about the slots and the sustainable funding, this year we had 6 slots available for behavioral health. Because of the number of defaults we've had, that opened up funding slots. And so we were able to use those slots for additional awards this year. Some things, I guess we'll start with the site transfers. All of these individuals, you should have received a letter that was sent out. That was their letter to request to stay in loan repayment, that they will continue to fulfill their obligation of serving the population, the underserved populations. And then they have have met with a community match and have secured a community match for the remaining dollars in their loan repayment. So the first one we had talked about back in February, the physician, Dr. Rachel Marole, she was granted that site transfer given that she was able to secure a community match. So I sent that packet to you. She has secured a community match. She had transferred from Great Plains and Williston to Mid-Dakota Clinic in Bismarck. And the other physician that is requesting a site transfer is Dr. Leah Thompson. She transferred from South Central Human Service Center in Jamestown to Southeast Human Service Center in Fargo. So you should have received both of those individuals that are requesting a site transfer. I don't know if you want me to go down the whole list or if you want me to go discipline by discipline.
I think we can do, we'll do discipline by discipline. Unless Allison, we can do the whole group.
Yes, I'm muted. Okay. You can do the whole group at once. If nobody has any questions, you can kind of do it as a
Okay.
consent agenda. Yeah.
Perfect. We'll do that then, Kaylee.
The next individual is Chelsea Smith. She's a certified nurse midwife, started at CHI St. Alexius in Williston, and she's moved to her own private practice as a midwife in Williston. That was the last document that Miranda sent over yesterday. To dentists, we have Dr. Callie Anderson. She's moving from Gar Dental Center in Carrington to Downtown Dental in Jamestown. And a Dr. Sarah Klebeen. She's moving from Joy Dental Design in Rugby to Oak Creek Dental in Bottineau. And our last group is behavioral health. Randy Berglund, she's a addiction counselor and a professional counselor from Southeast Human Service Center in Fargo to Benson Psychological Services in Fargo. The next one is Megan Colvinson. She's a social worker moving from the Department of Corrections in Bismarck to the Department of Human Services in Bismarck. Next is a Sarah Kellner. She's a licensed master addiction counselor and a licensed professional clinical counselor moving from Heartview Foundation in Candu to Evolution Counseling in Devil's Lake. Next, we have Chantel Kuntz. She's a LMSW from Badlands Human Service Center in Dickinson to Chatter Pediatric Therapy in Dickinson. Fifth, we have Kelsey LeBaire. She's a licensed clinical social worker moving from Heartview Foundation in Bismarck to her private practice, C&K Counseling in Bismarck. And last is Corey Stocky. She's a licensed professional counselor and a licensed master's addiction counselor moving from Winds of Change Counseling Center in Dickinson to Open Range Counseling Center in Dickinson. So those are the site transfer requests. You should have received all of their letters as well as their MOUs and community match support letters.
Thank you. Is there a motion to accept these site transfers? Anybody?
I would make that motion.
Thank you. Is there a second?
I second.
Any discussion? I guess the only thing that I want to keep an eye on is those transferring from a smaller community to a larger community. And I think there was just a couple of them. And again, I know it was based on priority in that, and a lot of them were a lateral transfer in the same communities or to a smaller community. But I know that this has come up to, transferring to a bigger city. So just something to keep an eye on. Is there any other discussion?
I had a question. The ones that are going into private practice, and then they have to have a community match, aren't they essentially providing their own match at that point? Because part of this program is they have to find a community match, correct?
Correct. And what's been allowed, and then that kind of goes back, Allison, if you want to support that. But from our understanding with Century Code is their businesses are allowed to match. They're like private businesses. Am I understanding that right, Allison? So that's where these folks are kind of getting in with their private practices, is they're having their own private practice be the match.
Correct. It does not specifically say that their employer can do it, but it does say any entity or corporation in the community, which would include their employer. If the health council disagrees with this interpretation, again, this language is vague. We would need to do administrative rules to inform the applicants that that would no longer be accepted. But right now, the committee is interpreting that as basically someone in the community has to hold the water if their employer is willing to do it. Good for them, I guess.
Okay, thanks.
Mhm.
Any other discussion? Okay, Miranda?
Sherry Adams,
Yes.
Mary Gumke,
Yes.
Missy Hankey,
Yes.
Carrie Ann Ranum,
Yes.
Mark Strand,
Yes.
5 and 0.
Okay, Kaylee, you had one more category, I think?
Yep, and the last we have to go over is the defaults. So these are individuals that are no longer eligible to continue in loan repayment. Some because they've moved out of state, and others because they are no longer meeting Century Code requirements. I'll go category by category. So the first one we have is Ashley Brown. She's a physician. She has moved out of state. She was originally at Great Plains Dental, or at Great Plains in Williston. The next is we have 2 advanced practice. We have Rebecca Coos. She was not able to secure the match. That was from last year. And Whitney Champa, she is not meeting the full-time requirement in Century Code anymore. Then we have our behavioral health group. Cassandra Hovitt is doing telehealth services, full-time telehealth services. Christy Miller is now doing, has kind of shifted to human resources. Jamie Johnson has moved out of state, and Delia Tucker have moved out of state. And then the dentist, Sarah Mertz, she did not meet Century Code requirements of the $20,000 of Medicaid reimbursement, and Alexa Carlson we're still working on. So those are our potential defaults.
Thank you. And I'm glad we have this system in place as well. Is there a motion to accept the defaults?
So moved, Mark.
Thank you, Mark. Is there a second?
I second.
Thank you. Any discussion? Any discussion?
Madam Chair, I have a question. Is there some discussion or some possibility to talk about solutions in or strategies we can think of to help with the number of defaults? I think this is a record we've seen in our program. Well, at least since I've been here, and from my past records that I can see, this is a record number of defaults and site transfers we've seen in the last year.
Yes, and I think in part that may be to what's happened over the last 2 years. It may be something we want to add to the next agenda, because I think there's several things in your category that might be warrant looking at, if that's okay to do that. Okay, so we'll do that. We'll plan on adding that to the agenda. So to figure out, let's look at that picture. We want to really look at some of the other things that were questions that were brought up today. And then we also want to potentially add another category. So if we can put all those in a lump sum for the next agenda item, I think that would be great. Any other discussion? Okay, Miranda?
Sherry Adams,
Yes.
Mary Gumke,
Yes.
Missy Hankey,
Yes.
Carrie Ann Ranum,
Yes.
Mark Strand,
Yes.
5 yeas, 0 nays.
Thank you. And we will for sure not lose sight of that, Kaylee, just in the matter of time, we'll try to make sure we get that on the next meeting.
Thank you.
Uh-huh. All right, we will go to Jason so that he can bring up his information.
Good morning, Madam Chair and members of the council. For the record, Jason Wall with the Division of Medical Marijuana. I know that some individuals may need to go, so I'm going to go very fast to make sure that you have a quorum to make any motion that the council may want at the end of going through these administrative rules. We are back mainly due to the fact that we've recently received information from our legal counsel in relation to fees requiring administrative rules. There's also a couple other changes that we have been considering due to the program continuing to expand and grow, which will provide some flexibility to the program to expand if it's deemed necessary. The first proposed change you'll see in the rules that were sent to you is on page 4 and at the bottom. This last session, changes were made to state law regarding fees that are established for the program. State law used to identify the specific amount that was to be collected. The legislature did modify language to state that a fee is to be in an amount not to exceed a specified dollar amount. We were recently informed by legal counsel that since the law in effect identifies the maximum amount to be charged, administrative rules must be established to identify what that amount actually will be. So the first proposed change to cover is on the bottom of page 4 there, and it's the first of 4 new proposed sections that relate specifically to the actual fee amounts to be collected. The fee on this page relates to the application for qualifying patients and agents of manufacturing facilities and dispensaries. The proposed fee for agent is at the maximum amount of $200, which is identified in state law. However, the proposed rule does identify a reduction of the qualifying patient fee from the current $50 to $25. Due to our increasing qualifying patient population, the opportunity does exist to have a reduction in the fee amount. I would like to point out as well that the soonest the proposed rules would be effective is October 1 of 2022. So if the rules are moved forward, a reduction in that patient application fee would not occur until October 1. On the top of page 5 is a new proposed rule in relation to the replacement fee. This would be $25 for a lost card, which is the maximum amount, and $5 for other replacement cards. The next change is on page 6, and this relates to when an open application period exists for manufacturing facilities and dispensaries. The rules do require a panel to be established for reviewing complete applications received. Based on the previous panels for reviewing applications, we do identify these panels can function and fulfill their responsibilities with fewer members. So the proposed change is the minimum would be reduced from 5 to 3, with the maximum changing from 12 to 5. On page 7 is a new proposed section regarding additional categories of medical marijuana establishments. State law does identify that these additional categories can be established via rule. We have seen in other states various categories being used on the manufacturing facility side of the program. So if it was determined that the program needed additional manufacturing facilities, the need for a manufacturing facility that would do both growing flower to take to market as well as processing may not be necessary. Additional categories of manufacturing facilities would provide flexibility to the program if that need does arise that we need additional facilities to meet demand of the program. So you'll see 2 proposed categories. One is a production-only manufacturing facility, meaning in effect that they can grow marijuana only and take that to market. They would not be able to do any extractions. The other category is a processing-only type of facility. While they would grow marijuana, it wouldn't go to market. It would be specifically they're growing marijuana to extract and make the medical marijuana products, which would be your concentrates, your patches, capsules, topicals, and solutions. On page 8 are the final 2 new proposed sections. The first relates to fees for manufacturing facility and dispensary applications. The amount is the amount that is the maximum amount identified in state law at $5,000. And the last section relates to certification fees. These are the fees that are paid once every 2 years by the registered entities, and I'll briefly cover each of the 5. The manufacturing facility, $110,000 amount. That's the amount that's been paid to date by the 2 registered manufacturing facilities and is the maximum amount in state law. The $90,000 amount, this would be the amount that the first one listed in number 2, the amount for a population of more than 10,000. That is the maximum amount, and that's the amount that have been paid by the 8 registered dispensaries in the past. In number 3, there would be an amount for a dispensary that's in a city with a population of 10,000 or less. We do have 1 current registered dispensary in a city with a population of less than 10,000. So in their next renewal cycle, they would see a 60,000 reduction if these rules were to be moved forward. In number 4, the certification fee established for one of the new categories just talked about for that production only or grow facility would be $70,000. And the last category for a medical marijuana product processor, the certification fee is proposed at $30,000. I said I was going to be fast. I don't think I could have talked any quicker or faster to get through that number of changes in regards to the rules. So I'm happy to answer any questions.
Before we answer questions or such, thank you. That was a very good summary. and thank you for doing such a good job with the program. Is there a motion to accept these changes?
Mark, move to accept.
Thank you. Is there a second?
Second.
Thank you. Are there any questions for discussion? Any questions for discussion? And any further discussion? Jason, you talked fast, but you did a great job.
Thank you.
Okay, Miranda?
Sherry Adams,
Yes.
Mary Gumke,
Yes.
Missy Hankey,
Yes.
Carrie Ann Ranum,
Yes.
and Mark Strand.
Yes.
Motion passes 5 yeas, 0 nays.
Thank you. And I think we got through all the things that had to be voted on in record time. So great job to everybody. We will go to Dr. Wiebe.
Yeah, thanks, Sherry. Good morning, everyone. And thanks for working out kind of like a solution for the meeting. And it is a record time and record speed. I'll just share a few updates from the Department of Health. As we kind of like maybe started discussing in our previous meeting that, you know, the Department of Health, when it comes to COVID and the COVID pandemic, we are transitioning to the pandemic stage. And what does that mean? It means that we are winding down some of the operations that are related to COVID. More specifically, the testing and the intensity of testing. It doesn't mean that we are kind of stopping all the testing and the activities. It will be just slowing down and kind of trying to have it available and maintain capacity. So then if and when there is any surge, then we have maintained the testing capability as well as any vaccinations or response capability. What also is we are finding now is that as we start shifting to other public health activities, we realize that there is a lot to do when it comes to vaccinations, other vaccinations, adult vaccinations, childhood vaccinations, as well as screenings, mammogram, all the other public health activities that we had to kind of like set aside as we were responding to COVID. So this will keep us busy as well as challenged because guess what? Like going through COVID, people now have some resistance to many of the public health activities. So we will have to kind of work on that front. The day-to-day operations, I think you hear on the news, so we are responding to the formula shortage. Since we provide many of the assistance and help for mothers to ensure that they have the access to formula for their babies. The peanut butter that is kind of like contaminated with salmonella, that's another front that we are dealing with. And we are making sure that we inform our public, our citizens about the existence of these contaminated peanut butter. And I just kind of like earlier this morning, we heard of many individuals, many citizens who had that jar of peanut butter that happened to be contaminated or like within that batch of possible contamination. So it is being used, and we want to make sure that each and every citizen is aware of that so that they take proper measures. We are also keeping a close eye to the monkeypox situation. Again, this is uncommon. Monkeypox used to be more prevalent in Africa, and then all of a sudden we find multiple cases in Europe as well as in the US. So far, we have a case in Massachusetts, one in New York. There are many suspected cases that are in the US. So we are keeping a close eye to this, and we have multiple calls with the CDC to ensure that we have most up-to-date information that we can share and respond accordingly. The last item I want to update on is the integration of the Department of Health and the Department of Human Services. Again, the official date of this integration into one Department of Health and Human Services is expected to happen September 1st. That's according to the bill that is signed into law. So now we are having a lot of meetings and a lot of decision-making meetings in order to make sure that as September 1st comes, at least the most urgent items that need to be attended to, like payroll or how the reporting system and having access to emails, having access to the software that is needed. These are things that are very urgent, and they have to be worked out September 1st. So we are making sure that these high priority items are being addressed. The integration process will take several years to be completed or to work through many of the opportunities where certain services from the Department of Health and the Department of Human Services can come together in the future. So again, our kind of the three integration principles that we have set to this work is making sure that our citizens have a one path or an easier path to navigate the system. We want to increase and enhance the quality, efficiency, and effectiveness of services. And the third principle is making sure that our team members are having more opportunities where they can grow and develop their leadership skills so then they advance their careers. So hopefully this is going on track, and September 1st will be the time when officially Department of Health and Human Services will come to existence. So this is kind of a quick update, and I'm open for any questions or comments that you have.
Thanks, Dr. Wiebe. Just one comment. With all of those different viruses starting to pick up and be all the different places, it just still shows the value of public health and all the things that we do. So thank you for the hard work. I think it's going to get, be busy throughout the summer as well. And the Jiffy peanut butter was in large stocks in North Dakota. So there was a lot of those people that had to toss their peanut butter. So any questions or comments for Dr. Wiebe? Great. Thank you all for making accommodations. We made it work. Thank you, Miranda, because you did a lot of the back work that while we were just waiting. So thank you for doing all that. And thank you, Allison, for always getting us on the right path as far as making sure protocols are in place. So appreciate every one of you. We will try to schedule another meeting in the next couple months or so to discuss some of the things that were brought up today. So I'll work with Dr. Wiebe and Miranda on that and try to get that time and date set up so we can get it out and everybody can get it on their calendars. Yes, Mark.
Does that include my email of a month ago regarding the possibility of having in the Century Code a program for loan repayment for public
Yes.
health professionals in particular? Okay, thank you.
Yes, that'll be part of that whole category. So I think there
Thank
was
you.
three, we're going to look at what Kaylee wanted that topic, and then just overall some of the questions that came up today on the loan repayment. So I think that in itself is a pretty big category to discuss. If you have other topics or such, please reach out to Dr. Wiebe and Miranda and myself if you have anything that we want to add to the agenda. Good questions. A lot of us are new, so I think it's really important that we, ask the questions. And thank you guys for clarifying them when they come up. So I think that is it for today. If somebody wants to make a motion to adjourn.
I make a motion to adjourn.
I was thinking everybody just wanted to stay on and visit. Thank you, Mary. Is there a second?
Second, Mark.
Thank you, Mark. All in favor for adjournment, say aye.
Aye.
Bye.
Aye.
Any opposed? Hey, we did good. It's only 10:34. So thank you very much, everybody. Enjoy the rest of the day.
Well done, Sherry.
Thank you, guys.